Well, it's a pleasure to introduce Hans-Rudolf Pfeifer, who has been very much involved in not only the work of Paul Tournier, but also of the
Geneva Conference on person-centered medicine.
On Medicine de la Personne. And he's going to tell about his experiences and about how he integrates this in his own practice.
Right. How much time do I have?
I'm not sure. I felt it was 12, but we started a little bit late. So can we take a few minutes more?
Okay, I need it. Huh? Okay, great. So I will take you on a time journey. First in history, back in history about 100 years and 50 years, but then we'll come back right into the present and into the future. And I retitled my contribution as a rediscovery of a person-centered approach in medicine and psychiatry. And you will quickly see it's quite exciting where things stand now and where things develop from here on. This is all goes back to people who have had a tremendous influence on the development of a person-centered approach. So this is the outline. Person-centered focus in medicine, historical developments based on Paul Tournier and Viktor Frankl. Then the international movements emerging from these roots, the international group Medicine de la Personne and international societies on logotherapy and existential analysis. And then also the ongoing Geneva Conference on person-centered medicine that has taken place since 2008, also awarding a Paul Tournier Prize, and which has had quite an impact on international organizations. As for myself, I have had the opportunity to both meet Paul Tournier and Viktor Frankl in their lifetimes. I did my thesis on a comparative study on Paul Tournier and Viktor Frankl. And so I plunged into the whole work, written work, and did some comparative study. And so that's the basis also of my talk. And so I will give you just a bit of that, which is really quite fascinating history. Then I will also bring some definitions. What is the difference between a people-centered, a patient-centered, a personalized, and a person-centered medicine or psychiatry? All right. So we have to learn to distinguish these four expressions. So there's Paul Tournier. Just a little bit about his life. When I've talked here and there, he is not so well known anymore, but he was very well known in the last century. Paul Tournier was born in 1898. His father died 2 months later. His mother died when he was 6 years. He was an orphan. He said, I fell into a black hole and it felt like I stopped existing. This is really an existential experience of great depth. He was then adopted or taken into the family of his uncle, who was a rather cold businessman. He went to school in Geneva, and he was more in a tree hut and busy with the dog, but he withdrew from people. He said, I was on the best way to become a very neurotic child and person. And then there was this teacher, Jules Dubois, who took time for him 1 hour per week to talk about anything. And he said that helped him to become a person in an intellectual way. He then became very active also he wrote that theater play. He was active also for Zofingia, that's Students Association. He held speeches in front of thousands of people because it was the centenary of this Students Association. So from this introvert, he became quite extrovert and socially involved. He also worked for the Red Cross and for the repatriation of prisoners of war in Vienna, and was active for Children's Aid, etc. A very active face. Here you see Paul Tournier in his young years, and also Jacques Ormond, that was the uncle with whom he grew up. And there's Jules Dubois, the man with the pipe here. So here he is in this Zofingia. He did his medical examination, then was assistant and opened his private medical practice. He married, he had 2 sons. That's his wife and the view of his practice. But somehow he felt something is missing. Now, he had a patient who was very difficult. And suddenly this patient turned much better, and he knew that it was not due to his therapy. And he asked this patient, why did it happen? What happened? And she said, well, I met this Oxford group. They taught me to be open, to be genuine, to share about my life, and also to do quiet time. And so he said, this is very fascinating. I want to meet these people. He met 5 people in November 1932. And he expected that they will teach him the points, what is important about this movement. But instead, they were quiet, they reflected, they shared their hopes, but also their failures, and were very personal. He had never experienced anything like that. And it touched him so much. It was a transforming experience. He was like a catharsis to him. For the first time in his life, he said, he cried about the death of his parents. He was 34 years of age. For the first time in his life, he cried about this fact in his life. And he started quiet time from then on till the end of his life, almost every day. And the first time he practiced that, he said, I didn't hear anything. Only one thing, continue. And he continued. And what he did was being quiet, maybe reflect something, but then collecting the impressions that he had, write them down, call this person, write a letter here, say no to this, or accept an invitation there, or ask your wife for forgiveness in a certain point, and so forth. So very practical. He did this quiet time, and that formed his life and made it very essential. He did not tell his patients about this, but strangely, the patients opened up to him like never, ever before. And he said, "Ils nous apportent ce que nous sommes prêts à recevoir." The patients bring the things to us that we are ready to receive. And this is an existential also experience. And it had such a dynamic in the next 5 years that he said, he was still a general practitioner. And those who needed more talk, he invited them back at the evening at the famous talks at the fireplace. And he had like a day life and a night life. And then he said, no, I can't continue like that. I'll change my practice. And he became like, a therapist or a counselor, and not anymore a general practitioner, and yet more patients than ever. He then wrote his first book, Médecine de la Personne, and it was published in 1940. And by the way, he had to go to military service, and during military service, he rewrote the book before it was published, and so it became even better. So sometimes also such times can be essential times when something is born that has an impact on others. And it was after the Second World War that he was totally surprised of what resonance his book, Médecine de la Personne, and that's the first edition here, what kind of impact that work had. They started the first meeting of the International Study Group, Medicine of the Whole Person, and they called themselves Group in Search of a Person-Centered Medicine. Group in Search of a Person-Centered Medicine. Then he gave first lectures in Athens, Greece. He wrote a book every 1 to 5 years. He wrote about 20 books. There you see him, and you see his fireplace. You see some of the editions. By now, there is his grandson researched that more than 950 different editions of his books. It's quite extraordinary. He had speaking tours in the United States. In 1963, he was the first speaker at the first International Conference of Christian Physicians in Amsterdam. So this is a place that for him was also bringing him to the world. Yes, he lived in Tournier. He also traveled to Japan, to Iran. He was able to lecture in Isfahan. 1974, his wife died. In 1978, he was again a speaker at the International Conference of Christian Physicians in Davos. That's where I met him as a young medical student. He did a tour in South Africa. Yeah, there you see Isfahan, where he also talked in the mosque. He was allowed to talk in the mosque. This is just to give you a few highlights of what kind of broadness of his mind, but also his impact that he had. In 1982, there was reconciliation with the movement, Oxford movement. He had distanced himself when they called themselves moral rearmament. Actually, it was moral and spiritual rearmament against rearmament with weapons in front before Second World War. He said this sounds too moralistic, was the distance. But then he reconciled with them. Today, this movement is called Initiatives of Change. And it's tremendous what this movement is doing. I'll give you the homepage also later. By the way, this movement, the Oxford movement, was the beginning of the 12-step program. It goes back to the same movement. And he has dedicated this first book to Frank Buchmann, who he says has had a tremendous influence on his life and has helped him to reflect about his true calling. And so it was the dedication of that book also to Frank Buchmann, but he developed his own ways. But it's so interesting to see that even the 12-step programs all come from this movement. All right, he died October 7, 1986. 2 years before he once more married a young, much younger lady. Well, it did have some impact on his life circumstances. Yes. Now, what is médecine de la personne? Let me go a little bit into the essence of it. So, médecine de la personne in English often is translated medicine of the whole person. In German, personale Ganzheitsmedizin. We need to understand and experience and understanding and experience of the person. The question of the purpose in life is very central. We have to exercise learning to listen to one another, to oneself, to God. And MDLP, Médecine de la Personne, is a basic attitude rather than a theoretical system. They also called it a humane medicine. More than, yeah. And then wholeness is an answer to medicine that has lost its sense for the human person as a whole being, thus paying the price for scientific advances. So he also fought against all reductionism in medicine. Wherever there is reductionism, he would stand up against it. Quite like Frankl. That was very essential. It was also called a synthetical medicine rather than an analytical medicine. Relationships is central. relationship to oneself, others, God. He called the spiritual dimension a dimension of relationships. He had a famous talk around that theme. It's not a technique, rather an attitude of a doctor. And in French, again, this is so beautiful. Il n'y a pas de médecine de la personne sans la personne du médecin. There is no medicine of the whole person without the person of the medical professional. So it involves this. We have seen this also in your slide, how this interacts. Yeah. Then there is the role of self-disclosure. It's not abstinence, like Freud would have taught. It's being honest, transparent, opening up yourself to the patient to a certain degree as a therapeutic means, but it needs to be well reflected and also taken into supervision if necessary. So it has its limits, but it is used as a therapeutic means, the self-disclosure to some degree. Then sincere validation of the other is so basic in everything. And then also the interdisciplinary cooperation with others, with all medical professions and clergy and etc. It is for all medical specialties and not only for psychiatrists and psychotherapists. Remember, he was a general practitioner and then grew into this, but he was not a psychiatrist as such, but yeah, he came from a general practitioner background, but it is really for all medical specialties. It's not an anti-psychiatry or an alternative medicine, and it is more than psychosomatic medicine by giving the spiritual dimension a high priority. He called it also pneumo-psychosomatic medicine. It is not a religious psychotherapy. A religious creed is not prerequisite for medicine de la personne, but medicine de la personne leads to a greater openness in the spiritual dimension. This is maybe also an important point. It is marked by openness and dialogue, and he often also referred to Martin Buber, I vow. He had someone who was had a lot of deep insights. It was Alois von Reli, who was his mentor, and he introduced him to Martin Buber and C.G. Jung and others and psychotherapists, and that helped him a great deal to grow into whom he became. It is called Socratic school, searching a way in dialogue, trusting that the essential will be revealed in honest, searching dialogue. And also, the meaning of life is not something that we can make or just put over a person, but it is something that we have to discover, to find. It's along the way. And ultimately, it's the patient who has to find for himself the purpose in life. It is also called a parabolic method, using the effect of life parables. Refers also to Jesus using a lot of parables and stories and his stories also in life. So these are some of the elements. Now, what did Viktor Frankl, say about Paul Tournier? He wrote in an original letter that I have when I corresponded with him about my thesis, regarding person-centered medicine, he referred to Paul Tournier, is the pioneer. He says there is a certain parallel between his rather person-centered approach and the Tournier's person-centered approach and his sin-orientiert, purpose in life-oriented approach or meaning-oriented approach. But was das Erstere anlangt, ist in meinen Augen jedenfalls der Pionier. He called him the pioneer of a person-centered medicine. And this is the original letter. This is this passage where he expressed that, in meinen Augen, der Pionier. And he also referred, they never met each other, but they read each other's books and they highly appreciated each other and they referred to each other when they talk and wrote. And so even in 1949, he had already perceived Tournier's work. Frankl had perceived Tournier's work and gave him high value, saying, was im Titel eines Buches, also im Sinne kann Psychotherapie gar nicht genug individualisieren und ist zu Recht eigentlich das, was im Titel eines Buches von Paul Tournier programmatisch ausgesagt ist, Médecine de la Personne. This is really quite interesting. So the impact of Tournier was that many people of all backgrounds and professions, ages, have been influenced and stimulated by the books and talks. Many health professionals have been inspired to seek an integrated way of spirituality, especially Christian faith. But as we see in this book, Medicine of the Person, to which I also contributed, there's all kinds of religious faith who they also take this approach, this person-centered approach. And in this book, you see it from different angles. And so this is quite interesting in that sense. So when I did my research on the thesis and beyond, I was amazed to meet people not only from Europe and America, South America, South Africa, Asia, Singapore, Australia, who had been inspired to go on their own way to seek that integration. So it is amazing what this simple man with an origin that was not promising at all had an impact on others. And I'll just show a few more things. International groups were formed in many parts of the world. And the next group of the Médecine de la Personne that has been going on for 76 years now is July 27 to 30 in Dorchen this year in Netherlands. And the theme is solitude and isolation in healthcare. They chose that theme in 2019 before COVID happened. And they couldn't have the conference in 2020, and nor could they have it in 2021. So they are having it now this year on that theme. Amazing. So solitude and isolation in healthcare. medicinedelapersonne.org. All the slides, I think, will then also be in the internet. Future implications, propagating the thoughts and attitudes further. Médecine de la Personne cannot just be taught. Paul Tournier was offered professorships. He turned them all down and said, I'm not really a professor. I have to live it and to teach others by example. That's also a challenge. The vision of medical practice of the person, of a hospital of the person, of a psychiatric clinic of a person was really his vision. Like I said, there's over 950 editions. It's now also in Spanish, Russian, Korean, Farsi. There are requests in Arabic language, Korean, Japanese, Chinese language. He must have written something that touches man in his existence. Otherwise, there would not be such a response. Right, that's the book, Medicine of the Person, Faith, Science, and Values in Healthcare Provision, edited by John Cox. And John Cox just did a video this January, The Healing of Persons, Médecine de la Personne, Reflections on Paul Tournier's Contribution to Person-Centered Medicine. And if you Google it, you will find it, John Cox, and Reflections on Paul Tournier, or The Healing of Persons. And you will find this video, a 1-hour video. It's a very interesting. John Cox, by the way, was for 6 years the General Secretary of the World Psychiatric Association. We met in 2006 in an APA meeting in the United States. And then he said we should do a book. So he did the book in cooperation with others. And then he did a conference. We get to that. The paultournier.org, there's lots of materials of Paul Tournier, also original tapes and books there. This is, by the way, the green meadow there where he lived. The wheat corn, his house was called the wheat corn. Then the Geneva Conference on Person-Centered Medicine. It was John Cox and Juan Message who suggested to have a conference in May 2008 with a special session on Paul Tournier. And we have now had the 14th conference online. And next year, April 3 to 5 in Geneva, again, face-to-face, it will be on person-centered prevention. Person-centered prevention will also be interesting. 20 world organizations have been involved. There's about 100 professors from all over the world, from all continents, from World Medical Association, the WONCA, this is the GPs Association, the WHO, the World Psychiatric Association, and the International College of Nurses, etc., etc. This was our first meeting there in May 29, 2008, with also the grandson of Paul Tournier, John Cox, on the right side. And Juan Message is really the one who has pushed this conference and coordinated this conference in an amazing way since the very beginning. He was the president of the World Psychiatric Association. So it goes right, into the heart of psychiatry, of medicine. And he had this vision, like you had mentioned it from the beginning, the vision for a medicine of the person, for the person, by the person, and with the person. You have explained that a little bit. Going into Tournier's work, you see that he actually, with médecine de la personne, he meant all of that. I can show that. And it was also Juan Message and John Cox who did, this was after that Geneva Conference, 20th to 25th of September 2008 in Prague, Science and Humanities for a Person-Centered Psychiatry. Quite visionary to have this theme. The homepage of this International College of Person-Centered Medicine is personcenteredmedicine.org, and there's also an international journal, ijpcm.org, and there's all these international organizations cooperating, seeking for a person-centered approach. And Juan Message clearly says, we're not inventing something new, we're trying to bring the essential back into medicine. Then since 2017, we have had a Paul Tournier Prize. And the first one was awarded right in the headquarters of WHO in Geneva. I mean, that's the real center of the medical world. And it was awarded right there. And so Wim van Leberge, who was also one who was involved there, Robert Cloninger, some of you may know his name. I could say a lot about him and what he has contributed. Alberto Perales from South America, John Cox from Great Britain, George Christodoulou from Greece, Jim Appleyard, also from Great Britain, Sandra van Doelman. She's a researcher for relationships, so she has done a lot of research also. So this small beginning has led to something that has a tremendous potential for now, for the future. Who would have thought that? And his facial expression, Tournier's face expression, kind of experienced that with a little smile on his face. I won't go into depth into that, but there are international organizations of logotherapy and existential analysis. We have had Langley, Professor Langley with us, and there's this existenzanalyse.org. There's also other directions and parts of logotherapy. I've just mentioned a few. If you Google them, you will find some in Germany, Austria, Switzerland. This is also spreading the person-centered approach and doing a lot of educational teaching for people who want to deepen their knowledge. And as you know, Ronnie, Hefty and myself have also gone through this training. And right, I'll finish off right away. Frankl, after he had come free from the concentration camp, Frankl had been in the concentration camp for 3 years and survived. He then wrote a book on counseling, and he said there is medical counseling and there is there is the spiritual counseling, or rather the church, or what do you call it? The pastoral, the medical counseling and the pastoral counseling. And he said, there's like a no man's land in between, but what a land of promise. And he said there is a relationship for them. And that was in the late 40s and beginning of 50s. What a land of promise. And I see now that this land of promise has taken shape and is starting to bloom and to develop. And just one remark: people-centered, patient-centered, personalized, and person-centered. People-centered is what is the best for a country, for a people's group, for a certain population or subpopulation. Patient-centered is for the ill person, for disease-oriented, to do the best for whatever it is. Personalized is more referring to analysis, to certain measurable things, and person-centered is the deepest of it all, to see man in his uniqueness. Personalized medicine is interested in biomarkers to determine the best medication, etc. This is rather individualized medicine. That's personalized medicine. But person-centered medicine reaches much deeper and wider, seeing and treating the person in his or her dignity, uniqueness, relational, and integrative aspects. That's the person-centered approach. And so the global view and development, when we started the Geneva Conference on person-centered medicine, there was always, we talked of biopsychosocial approach. And people were very hesitant to even use the word spiritual. And it was people like Tournier who have helped us to understand that, yes, this is part of the totality of the wholeness of the existence. And we need to talk of a biopsychosocial spiritual approach. And if you go on the homepage of the Geneva Conferences, personcenteredmedicine.org, you will see declarations for every year's conference. And in the beginning, you don't find this word, but now it is used in a very natural way, that this is a part of our humanness, of our human being, or even biopsychosocial, eco-spiritual. The echo now also comes into it. Merci. Thank you for your attention.